Hey, this is Malcolm Fleschner for TYT Politics in San Francisco. Bernie Sanders is about to make a speech where he's going to promote his Medicare for All plan that has got, I guess, a third of the Senate Democrats to support and building a groundswell of support. And here I'm here with nurses at the CNA's convention. Is this the annual convention, Maureen?
Every 3 years.
Every 3 years. Okay, well, I'm with Maureen Dugan. And Maureen, where are you from?
San Francisco.
Okay, so you're a local, and so it's easy for you to come out, but why are you, as a nurse, why is this an issue that you feel strongly about and passionately about?
It's so needed. I mean, we see patients needlessly suffering every day. There's no reason for it. We're a wealthy country. We can make this happen.
So when you say needlessly suffering, how would a Medicare for All plan, from your experience, or a single-payer system, whatever that they have in other like they have in other developed countries, how would that affect the care so that people who are suffering now would not be in the future?
Well, they wouldn't be denied access to care. They would have access to care, and everything we're trying to do for them would be included. I see all the time people are sent home. Their insurance doesn't cover home care services. There's procedures they don't cover. There's equipment they don't cover. Medications that the patients have to pay for out of pocket. So the stress of being ill would be gone in terms of the financial aspect. You could just focus on getting better.
How widespread is support for Bernie or other single-payer plans among nurses in general? You're here, so you're an activist, obviously, and you care and passionate about this. But generally speaking, how broad is the base of support for single-payer?
Oh, I think it's huge, and we're also seeing it with the new progressive wave of Democratic Party activists in California. It is going to be a litmus test. It is a litmus test. We know that we can do it, and again, everybody sees the suffering. Everybody's got a story of someone that was denied care, was diagnosed late, and then succumbed to the illness because they were not treated as early as they could have been. So I think there's wide support for this.
And do you think that nurses have a unique perspective on this and can be particularly good advocates in favor of single payer?
Absolutely. Like I said, we see this every day. We see patients that are denied entry into the hospital, or again, they don't get services at home. There's procedures they get denied for, or they simply know that they can't cover the costs, and so they don't go in to see a doctor, and then they present to an emergency room and they're very ill. So all around, we need better prevention, better mental health, and again, covering all the other services.
And so what are nurses going to be doing between now and 2018 or 2020? What do you foresee the nurses' role in promoting single payer and making this happen? And if it's going to be a litmus test, what's the pressure? How are you going to bring that pressure to politicians?
In California, we're already doing that. We've got activists in every assembly district. They're knocking on every door, eliciting support from the public. And again, we'll be putting pressure on all our politicians. And we're continuing to put the pressure on that this has to happen. You can't just say you're for it. You have to show us that you're working for it and working with us to make it happen.
Well, that seems to me one of the questions a lot of people have about the senators who have presidential ambitions, the Democratic senators who have offered support for Bernie's bill, whether they're going to follow through and be strong in supporting it as we move towards 2018 and 2020. And it seems like the nurses that's sort of going to depend on you and the rest of us in how well we hold their feet to the fire.
Right, and we will. The nurses are definitely going to hold politicians' feet to the fire. And like I said, these young activists that are here today to see Bernie, they're not letting this go either. So that is helping turn up the heat on this fire.
All right, well, thank you very much. It looks like we're starting to get started here. So thank you very much to Maureen Dugan for talking to me. I appreciate it. Have a great day today.
Thank you.